it's a reality that the pembrolizumab and enfortumab data look very impressive, and we saw updates here from Dr. Van der Heijden. And I think the vast majority of patients in the US, where there is access to pembro-EV, may get that regimen. Having said that, there are many parts of the world that pembro-EV may not be accessible to. And there be reimbursement issues, so I want to think about the global oncology. And I think there's still a role and space for the JAVELIN Bladder 100 treatment paradigm, especially when there's no access to pembro-EV. And I think it's important to keep generating data and long-term follow-up. And that's what we did in this meeting, GU ASCO 2024. We had long-term patient-reported outcomes, quality of life data from the JAVELIN Bladder 100 trial and practice-changing study that was presented in 2020. As you mentioned, there is a long-term follow-up now. And what we saw was that we have significant, clinical significant, statistical significant overall survival and progression-free survival benefit with Avelumab maintenance after response or stable disease to platinum-based chemotherapy, and that survival benefit comes without significant detriment in quality of life. So the long-term patient-reported outcomes data further support the use of Avelumab in those patients who have already received disease control, no progression with induction platinum-based chemotherapy. So I think this gives confidence that with long-term follow-up, the quality of life seems to be maintained. And I think it's a relevant discussion with the patient in front of you that if you go on Avelumab maintenance, the survival benefit does not get compromised by a negative impact on quality of life, because quality of life matters in those patients. They come frequently, right, every 2 weeks to get the treatment, but I think because the treatment is usually well tolerated in the majority of patients, I think it's important to see this data. In the same context, we have to be careful and mindful, of course, for immune-related adverse events with any immunotherapy. But overall, there is no new safety signal. There's no new toxicity signal with long-term follow-up. In addition to that data set, we saw the data from the PATRIOT-II study. This was a real-world pragmatic study in the US. We tried to look at the Avelumab maintenance after response or stable disease to platinum-based chemotherapy in those patients who are not part of a clinical trial, to see a real-world snapshot. And what we saw in PATRIOT was very consistent with the JAVELIN Bladder 100 trial data. So we saw the similar overall survival, we saw similar PFS, and we saw similar side effect profiles. So we see real-world data in the PATRIOT-II study that corroborate, complement the JAVELIN Bladder 100 trial data, which I think is relevant, again, to discussion with the patient, that you have real-world evidence going together with the trial data. And we had other data sets. We published with Dr. Bakaludi, one of my mentees at the University of Washington, a real-world study, retrospective data, and showed the same thing. The data in retrospective data sets seem consistent with the JAVELIN Bladder 100. And the same thing with studies in France, like the Avenance trial, and also in Italy, and also in some areas in Japan and Korea. All these data sets show that real-world evidence data are consistent with the JAVELIN Bladder 100. And I think, as you mentioned, there are ongoing trials in the switch maintenance setting. The MEDLEY trial, I think, is a very interesting one. We look at Avelumab versus Avelumab-based combinations, try to see if there is a signal if you combined Avelumab with another agent, for example, sacituzumab govitecan, or other immunomodulatory compounds. And the MEDLEY trial will probably read out in the future. We're going to have some signals there. And the MAIN-CAV trial, the phase 3 trial that Dr. Gupta is leading in the Alliance Cooperative Groups, which is switch maintenance Avelumab alone or Avelumab plus cabozantinib. And I think that will be a very interesting phase 3 trial looking at this maintenance question. And I think it's important. We saw some data yesterday by Dr. Jain looking at cabozantinib pembrolizumab in the frontline cisplatin ineligible patient population. And so I think this adds some at least interest in how the MAIN-CAV trial will perform in the future. So overall, we're living in an explosion of new data in urothelial carcinoma. We saw pembro-EV, we saw GEM-CIS-NIVO in CheckMate 901, and of course the JAVELIN Bladder 100 that has been around for a few last years. And we look forward in the future for more therapy options for our patients. Hopefully we can prolong life even more. Hopefully we can keep helping with quality of life, and hopefully we'll have more cures and curative options for our patients.